toxic symptoms. Toxic symptoms in the adult are rather a measure of renal retention than of renal infection, but children with chronic renal infection often exhibit one or the other of the types of toxic symptoms, although they apparently have no gross retention of urine in the kidney, pelvis, or bladder. The toxemia of renal infection shows itself in 5 types: digestive symptoms, cerebral symptoms, hiccup, rheumatism, high blood pressure. Digestive symptoms. The digestive symptoms of renal insufficiency, if mild, may be due either to infection or to retention. If severe, they are commonly considered evidence of renal retention. Superficially, these digestive symptoms resemble those of so-called chronic indigestion. The bowels are likely to be constipated, the patient thin, sallow, and anemic, the appetite fanciful, and the patient usually complains of various abdominal discomforts, lassitude, and loss of weight. But the striking feature of this toxemia is what the French call Buccal Dysphagia, subjective if the toxemia is mild, objective if it is severe. In mild cases, this amounts to little more than a dryness and stickiness about the tongue and the pharynx, which the patient may vainly endeavor to control by drinking large quantities of water. In the severe cases, the tongue not only feels dry, but is visibly dry, parched, red, pointed, and may even be cracked and fissured. The condition of the tongue is one of the most dependable physical signs in the prognosis of urinary infection. As the renal function is more and more impaired, the tongue and pharynx grow drier and drier, while if improvement occurs, the moistening of the tongue is often one of the first signs of this. Plate 12. Plate 12, the tongue of urinary septicemia. The tongue is parched, scarlet, narrow, and pointed. It is often covered with a thick coat and may be cracked, as shown in plate. When the tongue is moderately dry, the patient actually cannot eat dry, solid food. If the tongue is excessively dry, he cannot even swallow fluids. Cerebral symptoms. Cerebral symptoms arising from renal infection belong rather to pyelonephrosis than to pyelonephritis. Yet the very rarity and obscurity of such symptoms when arising without an evident septic cause is enough to make them remarkable in this connection. Cerebral symptoms indicate grave inhibition of the renal function. The cerebral symptoms, if mild, consist of little more than an undue irascibility and inability to sleep, with some tendency to headache. If more severe, the patient becomes flighty at night, but is likely to be quite rational during the day. Rarely there may be attacks of excitement approaching the maniacal. The most severe symptoms are seen only in connection with the digestive symptoms and the characteristic dry tongue. The patient is quite incoherent and usually rather inclined to be dull, stuporous, and comatose than excitable. Hiccup. Persistent hiccup, like the dry tongue and the cerebral symptoms, is an ominous sign of grave impairment of the renal function. Such being the case, we may remark parenthetically that it is quite futile to attempt to treat persistent hiccup by any remedy excepting those designed to eliminate the poisons that the kidney cannot transmit. Rheumatism. Although toxic pains in various parts of the body form part of the picture of any grave toxemia, rheumatism of any importance is not usually due to toxemia of renal origin. High blood pressure. High blood pressure is a characteristic sign of the toxemia of non-bacterial nephritis. This may well be associated with bacterial nephritis, but the toxemia of the latter does not cause elevation of the blood pressure.